Hello, I'm called Namsoke Rose, a midwife from Gulu Regional Referral Hospital. Today I'm going to talk about intranatal care. Intranatal care is care given during childbirth or labor. Childbirth is a normal physiological process, but complications can occur during that time. That every pregnant woman is at a risk of unpredictable complications, which can lead to either the death of the baby or even the mother, or morbidity. That the presence of a skilled personnel is a key or strategy to prevent these complications. So, skilled personnel like midwives, medical officers on the ward, obstetricians are a great role during this time. Though midwives are always with the mothers. A role of the midwife during intranatal is very important. Midwives are skilled health professionals with knowledge and care, and that can give care and support to women to give normal childbirth. A normal childbirth is when labor starts properly and gradually. Then a midwife checks you, checks the fetal heart, examines you as a mother, finds nothing is there as a complication, and waits for you to deliver properly without calling a name or an obstetrician. The midwife will do this. There is continuity of care with the midwife. What do I mean with this? A continuity of care, though, is supposed to start from antenatal. But from antenatal, it continues up to the labor suite. A midwife will be with you, will talk to you as a mother. She will create rapport so that she reassures you to prevent all anxiety, and you get a positive childbirth. That is continuity of care. And after that, the same midwife can continue after delivery postnatally to take your observations during intranatal, even after intranatal care. A midwife, through their clinical observations, they will anticipate. Since I told you at first that they are professionals who are trained to help a mother give normal childbirth, but through their clinical observations, they will anticipate anything that is deviating from the normal childbirth, as I said, to abnormal. And after that, they will call the medical officer or an obstetrician, or they will call the specialists in case of any arising need, so that quick action is taken. A midwife will always act in emergency care. In case anything is deviating from normal to abnormal, it is a midwife who is expected to call the specialist. And during that time, as the specialist is arriving, maybe they are in the clinic seeing other mothers, the midwife will always do emergency care so as to bring up the life of the mother or even the baby. A midwife always helps a mother to cope up with anxiety during labor by reassuring her. Most mothers, if they are not reassured, anxiety and stress can cause prolonged labor during this. Midwives will always monitor labor progress. What I mean with this, if a mother is in labor, a midwife will always take your blood pressure, will always take the number of your contractions and how severe they are. A midwife will always do that, take the fetal heart of the baby to see how your baby is breathing. We'll always see how your labor is moving on. Like if she has checked you and the cervical opening, the opening is about 4 centimeters, there you've now entered active labor. She will tell you when to check you again. She will tell you maybe it's after 4 hours. But again, before that time, she's done to tell you that during that time, if you see the water powering, you come before that time. And in between, before that 4 hours that you're supposed to report, she's the one to keep checking the breathing of the baby every after 30 minutes to exclude any complication or any abnormality that can arise within that time. That in case it does so it is the midwife who will take action by calling an obstetrician, MO, and it comes as an emergency, and they work as a team. you.